You said you spent 1 year deciding and preparing. How? What do you think about that year now, looking back?
You know, I remember having so much angst and worry and concern every time I would go for the 6 months,
Right.
you know, to get a checkup or go to an appointment. It just made me quite nervous. I would think about my family a lot. I don't want cancer for myself, but I certainly don't want it for my children or for my parents. I would hate for them to have to undergo something like that. And I guess that year's worth of time, it was important to me because I wanted to be very well armed with information, but I really kind of think I knew from the beginning where I was headed. I tried some of the other things and it just didn't work for me. So I took my time and I met with several, like I said, several physicians, several plastic surgeons, oncologists.
So you sought more than a second opinion?
I really, yes.
Oh,
I am a believer that you have to take charge of your own health. And having been a medical reporter for so long in my life, I'm not afraid to ask questions and I'm not afraid to go for multiple appointments. And I really just, I wanted to make a sound decision based on facts, but also you can't avoid the whole emotional piece of it. I think what is a blessing now for me is that I just don't worry about it anymore. I really don't think about it very much anymore. I do have another procedure I need to go through, but it's simple. And I just don't worry about cancer anymore. And cancer, that big C word, it's scary. It's very scary.
Yeah. This surgery, does it have anything to do with reconstruction?
Yes,
by
yes.
Any chance?
You know, certainly after you undergo mastectomy, I could have skin sparing and nipple sparing mastectomy. And so you first you have the mastectomy and I had expanders in place. And then, you know, they fill the expanders to allow your skin to sort of grow back until you reach a determined, you know, the size that feels correct for your body. And then you go in for a second surgery to have the implants placed. It's not very unusual then to need additional surgeries. I'm going to have fat grafting just so that they can sort of make the cosmetic look of the breasts more natural. That is not a particularly difficult surgery, but the mastectomy surgery is difficult.
Tell me more. How was your post-op? Emotionally and physically, if you can, if it's not too difficult.
Yes, I can. For me, the worst part of the entire journey was just making that definitive decision to do it. Gotcha. I cried so many times before that. I really had a lot of fear and a lot of questions, and the more that you learn about mastectomy, sort of it increases your fear. But I remember one distinct moment in time that I just said, you know what, this is my decision, and I'm not going to second guess it. I'm not going to ask for another opinion or talk to another person, because for me, in my mind, this is it. I'm decided. And so once I did that and I reached that place and I told myself, I'm not second guessing this anymore, I never cried again. I think it was just my process. I had to make the decision. And once I did, everything was a little easier, because then it was just taking care of business.
You didn't look back. Wow, that's amazing. Yeah. I can see that. Yeah, I can totally see that. So after surgery, you come home and, like you said, you take care of business. You take care of your wounds and your scars and
the surgery itself obviously is painful, but, you know, they give you medications to help control your pain. The difficulty is really the drains are a hassle. You know, you have to wait a while before you can shower and all of that. So, you know, there are complications, but it's hard for me to really complain because I feel so blessed in a way. I'm not blessed that I had to do this or felt that I had to do this, but I feel so lucky that I got the choice, because so many women have to undergo surgeries like this under the gun when they're facing horrific odds or they're facing terrifying diagnoses. And I got to choose. So I feel blessed, which might be a strange way to look at it, but I do.
Not at all. I say that, every day. And we had and we have some time in our on our side.
Yes. But I would not, I don't, if you ask me if I regret anything, I do not. No.
Good.
Yeah.
Yes. I was not going to ask you that,
but
I'm so glad because I can see you don't, and I can see you're a source of strength and energy and power, and that's great.
I try to be. It's hard though. This process, it will take a lot out of you, but we women are so tough. I am, the older I get, the more impressed I am with women. We are tough creatures. We are extraordinary beings. And I think that most of us do almost everything that we do for others, or at least a lot of us do.
No, we're
trained. And I love that about women. I think women are incredible.
They are, and we realize we're stronger than we thought we were every day.
Always.
Absolutely.
Yes, because life is going to throw obstacles at you. That's just what life is. And you can either, dig under them or climb over them or kick those suckers right out of your way. And sometimes you just have to muck through it. But, that's life, and we're tough.
These are life lessons for sure. Yeah. I want to go back a little bit to LCIS and our support group on Facebook. I want to throw a number out there. I would say that from the posts and the conversations we have there, I want to say 80-90% of the women there have had or are about within the month to have mastectomies. Wouldn't you agree? Or the conversation revolves much around that?
I do see that a lot.
What does that make you think of this LCIS?
A couple of things. I think that maybe it's because women who are diagnosed, or maybe the women who join that group are a little further out from their diagnosis. Maybe they're starting to think about being aggressive with treatment, and maybe they're searching for a sisterhood and a support group, because let's face it, most of us don't have friends who've had it or don't have relatives who've had it. So I guess maybe that could be one reason why so many women in the group are talking about mastectomy. And another reason could also be that maybe just more women are choosing that as an option from the get-go. And I don't know why, but it could be too that we, like me, maybe lots of women have experienced cancer in their lives and they've seen it and they want to do anything that they can do to prevent it from happening to them and to their families.
Yeah, exactly.
It is somewhat of a radical decision, some would say. And it's not an easy decision. And I think you almost really can't give advice to anyone because it needs to be your own personal decision.
From what I was told from surgeons, LCIS about until 10 years ago was by default treated as cancer, and the double mastectomy would be the gold standard for treatment. And this method has changed over the last 10 years towards going away from the double mastectomy. But it's interesting how the women themselves, the patients, the people going through this are choosing the gold standard again, or going back to that. I think for peace of mind and for running away from the scanxiety and from cancer.
I love the term you just used, scanxiety.
Isn't it amazing? It's not mine. It's amazing. It's not mine. Instagram will teach you.
Perfectly fitting term, though. That Isn't is a perfect word. I'm going to borrow that if you don't mind.
I do. Yes, it's not mine.
I certainly had scanxiety.
Of course, of course. And
Yeah.
for that peace of mind, and for the peace of mind that knowing that your children will grow having a mother, and so many other things. I mean, maybe the body itself or your self-image can take a brunt, and that's the price to pay. Maybe.